Hello, hello, hello. Hello, everyone. Welcome to another brilliant afternoon tea with docs. I'm Dr. Linda. If we haven't met before, I'm an emergency physician here from Sheffield. And I'm here with my lovely co-host, Dr. Erica, who is a GP from the West Midlands. And we are both lifestyle medicine physicians. It's so wonderful to see so many of our current guests. Hello, Tara. Hi, Jenna. It's lovely to see you and to see so many new names joining us too. We would love to get to know you all. Do share away. Let us know where you're from. What is your favorite hot or cold cup of tea? And of course, we would love to know what lifestyle changes would you like us to help you with so that you can live your best life. Today, we are so excited because we have our first of many afternoon teas with Bslm, British Society of Lifestyle Medicine. And we are delighted to be joined by the Executive Director of Bslm himself, Dr. Fraser Quin, to talk about where next for Bslm. We dedicate each month to covering a different health topic, and July is Cancer Month. We are discussing everything we can do to prevent, treat, and reverse different types of cancers. And on the last Sunday of every month, you can tune in to hear our Empowering Patient Success Story series, where we share how patients use the lifestyle principles and nutrition to aid their battle with chronic diseases.
So we host Afternoon Tea with Docs every Sunday at 5 o'clock, UK time that is. Where you can connect with world-renowned lifestyle medicine experts. And each afternoon tea event is divided into two parts, the first hour being a live interview accessible to all on YouTube, Instagram, Facebook, where we debunk misinformation on healthy lifestyle practices and aim to share 3 actionable takeaways that you can implement right away in your life to start beating modern lifestyle diseases like heart disease, lifestyle-related cancers, diabetes, and many more. And the second half of our event is only accessible to those of us who have joined us on Zoom. And it's a cozy, non-recorded half hour where you can get to know the Afternoon Tea with Docs community, speak to us and our lifestyle experts about your health goals in a safe and private environment.
And if you're ready to implement your health goals, join our free membership in our website to be part of our supportive community to learn and implement evidence-based health lifestyle habits. So, together it's so much easier to achieve our goals. The links are noted in the chat and also added to YouTube in the future.
And so, to introduce Dr. Fraser Quin, he brings a wealth of senior executive experience to Bslm, with CEO and board experience in both the private and third sectors. He has considerable experience of change management, growth, strategic planning, HR, fundraising, and project management. Governance is a particular strength, and Fraser is currently a non-executive director of ARC Housing Association and was previously chair of Deaf Action, Scotland's largest deaf charity. He also has a background in higher education and was formerly a senior lecturer in environmental economics, completing his PhD at Edinburgh University. Fraser is also a strong advocate for lifestyle medicine and, in his own words, living the dream as a keen cyclist with his type 2 diabetes currently in remission. He is also an avid motorcyclist and regularly tours Europe and the UK on his Triumph. Welcome, Fraser.
Welcome, Fraser. Thank you so much for joining us. You're mute.
Yep, there we go. Sorry. Yeah, thank you very much for that introduction, Erica and Linda. And first of all, thank you for your fabulous support of the British Society of Lifestyle Medicine and for a chance to speak to you today.
It's amazing to have you with us. And me being an avid cyclist and a lover of motorbikes, I would love to find out a little bit more about your lifestyle and what got you on the path of reversing your type 2 diabetes.
Yeah, that's a very interesting question because I was diagnosed with type 2 diabetes over 10 years ago now, probably 15 years actually, which is quite frightening in a way. And I think it became very clear to me very soon that I would have to do something about type 2 diabetes myself in order to, and I had no concept at this time of curing or putting type 2 diabetes into remission. I just knew that if I was going to be living a more healthy lifestyle, that would actually help my type 2 diabetes. But some years into the diagnosis, I came across Michael Mosley's work with his 8-week diet, and became aware of Roy Taylor, Professor Taylor's work in Newcastle around type 2 diabetes remission. And this is before I'd even heard of lifestyle medicine or the British Society of Lifestyle Medicine, and just decided actually to take control of my own condition. So probably about 6 years ago, I decided that I needed to start exercising. I'd always been really quite sporty, but in my sort of, in my 40s onwards, that had really tailed off. So started running and cycling again, and really started to look carefully at my diet. I knew the dangers of processed food and excessive red meat and so on, but really hadn't really framed that in any kind of particular program at all. But just started eating less manufactured carbohydrates, so less bread, less potato, added more vegetables into my diet, ate less red meat, and continued exercising. So ultimately I lost 5 stone over a 4-year period, became very fit, and actually I'm probably as fit now as I've ever been in my life, which is absolutely fantastic. And that has helped me control my type 2 diabetes. And that's something that I want to continue to do for the rest of my life, which is not easy, because behavioral change is something that you have to keep going at. It's not just something once you've done it that you've cured yourself, in a sense. So I appreciate I need to really learn more about lifestyle medicine, keep going for my personal goals, health goals moving forwards. But interestingly, it was this journey that really brought me to the British Society of Lifestyle Medicine. And when I saw the vacancy for the executive director of BSLM, I thought, well, I have the skills that they are looking for, but actually I also have the commitment to lifestyle medicine that they're looking for. So decided to apply for the post and talk to them about my story. And thankfully, Dr. Rob Lawson, who I think most of you may well know from last week or last couple of weeks ago's afternoon tea with the docs, selected me for the post, and I'm absolutely thrilled to be here.
Wow, what an inspiring story. And isn't it just so refreshing to do a job that actually makes a difference in people's lives, and it kind of fuels us to do the best we can for both ourselves and our patients, and of course an organization that actually makes such a huge difference, not only in the lives of our patients, but also in the lives of our colleagues and physicians. Because of course, if we see changes in our patients and if they're getting better, that fuels us as well. I'm sure you come across these stories through BSLM, and it really adds to your life and your quality of life.
The stories that I come across in BSLM are absolutely inspirational, and actually, to save your blushes, people like yourself, Linda and Erica, the work that you're doing in lifestyle medicine is just inspirational, and there's so much of it going on out there. I think what is nice for me is to be able to think about it from a very personal perspective as well. So I've been there. I've been in difficulty with my health. I've done something about it, and I can now see that lifestyle medicine is the way forward. But more importantly, I can actually share my experiences and empathize with people who are talking about like their own issues, their own behavioral issues around food, around exercise, whatever it might be. But signpost people to the fabulous work that's going on out there. Literally dozens and dozens of people working in this area, promoting lifestyle medicine. So looking at it from both sides is a really interesting perspective on the job I have, actually, both as patient and as a part of the management structure as well.
And that brings us on. What is lifestyle medicine in your terms? What do you think?
Well, very simply, and I should point out to everybody on the webinar this evening that I'm not a clinician. So my PhD is in economics. So I come very much from the business side of things. But from my perspective, lifestyle medicine is all about it's individual responsibility, but it's about the system supporting people to be able to achieve individual responsibility. What lifestyle medicine is absolutely not is about blaming and shaming people, and I really want to stress that strongly right from the start. What it's about is supporting people to find their own solutions, and I think that's critical, because lifestyle medicine, you know, there are 6 pillars of lifestyle medicine: physical activity, nutrition, sleep, and so on and so on. But lifestyle medicine is absolutely about the individual. It's about finding the solution for the individual with your clinician, or actually from time to time on your own, which was my case, because I really wasn't getting much support from my GP, and I say that with all you know, I'm careful about saying that, but I think I should say it. So it's about an individual journey and finding one's own way through this, and that's different from everybody. There is no one solution for everybody, and I think that's the exciting part of lifestyle medicine. Whilst there are very clear kind of guidelines and practices and programs that we may want to adopt, everybody's going to do things differently, and I think that's what's quite exciting about lifestyle medicine.
You do say that unfortunately you didn't have the right support from the GP to go on your own diabetic reversal program. What do you think? What are we facing as difficulties from stopping us to doing that from your perspective?
Well, I think there are several things, and there are several things that relate direct to BSLM as well. So the first thing, obviously, everybody will be aware that appointment times are very, very short, and even now, appointment times are becoming shorter. I mean, just to put this into context, I actually contacted my GP a couple of weeks ago, actually about a back problem, not about anything to do with type 2 diabetes, and I still haven't had my appointment, and it will only be a telephone appointment. So in the meantime, I've sorted my own back problem out by reaching out to a lifestyle medicine specialist in pain and in musculoskeletal, which has been hugely helpful. And actually, I'm very humbled by the fact that I'm able to do that in my position, because clearly not everybody is able to do that. So there's a time factor, but also there are still a huge number of clinicians out there that don't know about lifestyle medicine and don't know about the British Society of Lifestyle Medicine. And really one of our real aims and objectives in the next sort of 1 to 5 years is to make sure that we expand the message and to get the word out there, to ensure that people, clinicians, professions, everybody working in health is at least aware of lifestyle medicine and has the opportunity to engage with us around education and so on. And then finally, I think one of the key factors around sort of my own journey was that group consultations is something that at BSLM we really support strongly. Peer support and actually talking to other people with type 2 diabetes is incredibly important. And again, the vast majority of clinicians are either not aware of it or actually don't have the time to implement those programs and the money at the end of the day, because you know there is a cost associated for GPs to implement group consultations. So I think a whole series of things just actually conspire against GPs to make it less likely that they can engage in a more appropriate way with patients around any whole series of things that might be applicable to lifestyle medicine, not just type 2 diabetes.
And then what is BSLM, British Society of Lifestyle Medicine, and how do you think it will be able to help our colleagues and our patients in moving forward? It's only been 5 years since BSLM was formed, but it has created such a huge traction because we know it's the right way to go, meaning that our job is to address the root causes of diseases rather than just treat symptomatically. But as you just mentioned, there are quite a few things that are standing between the practical aspect of application of lifestyle medicine and the future when we will be able to do so. So I'd love to hear what BSLM is and what do you think, how it could help in the future?
Well, in its most basic terms, the British Society of Lifestyle Medicine is a charity. It was constituted in 2016 by Dr. Rob Lawson, Dr. Lawrence Stewart, and Dr. Michael Boyle, as you heard previously in a previous webinar. The charity was formed really to formalise lifestyle medicine in the UK. The term lifestyle medicine has been around for a long time, as I'm sure you're aware. Certainly 30, 40 years, people have been talking in these terms. And lifestyle medicine in other countries is much more firmly embedded in the national health system. So in America, for example, lifestyle medicine is recognized as a practice, just as oncology is, or other specialisms, whereas in the UK, that's not the case. So really, in terms of an ultimate lofty goal, the British Society of Lifestyle Medicine, it really aims to have lifestyle medicine entrenched into the National Health Service formally and recognised by all of the various colleges as a key part of the health service. But the way to do that, from our point of view, is to establish BSLM as the key membership organisation in the UK, and Dr. Rob Lawson and his colleagues have done that. So currently we've had over 2,000 people have joined the British Society of Lifestyle Medicine, clinicians, health professionals, physiotherapists, occupational health professionals, and so on. And our role is to ensure that we expand that membership through activities around the promotion of lifestyle medicine through individuals like yourselves, so people who are practicing. We have just under 50 regional directors who are promoting lifestyle medicine in their own areas. But one of the key things that we think moving forwards is going to be, is one of the key projects for BSLM moving forwards, is the establishment of a Learning Academy. So it's to formalise lifestyle medicine learning in the UK. So currently we administer the International Board of Lifestyle Medicine, which is fantastic, and I know some of our colleagues on the call tonight will have done that course. But we are seeking to establish the British Society of Lifestyle Medicine as the educational centre for lifestyle medicine. Now, there's a lot of competition out there because there's a lot of people operating in that area. But if we establish ourselves further in terms of membership and the go-to organisation in terms of standard setting, in terms of monitoring and evaluation, in terms of accreditation, then that will really spread the word of lifestyle medicine. So our goals really in the short term are around expansion of membership, expansion of our learning activities, but also expansion of our social media communication strategies and public affairs strategies, so that we're actually reaching the people that we need to reach to spread the word around lifestyle medicine.
With BSLM being the leader in lifestyle medicine, I think it really is very important to get the word out to our colleagues, really how they can implement lifestyle medicine in their current practice. We had a few questions from our colleagues, and I think I have to ask, when they do get the diploma, which is something you can get every single year around September time, and if you're a GP or a cardiologist, oncologist, how does it empower the clinician in their daily clinical practice?
Well, I think it does two things. I think it gives the clinician the tools to be able to take lifestyle medicine forward. But I think what it also does is it when you do the diploma, you become a member of the British Society of Lifestyle Medicine as well. So what it does is it kind of allows you into a network and a kind of a support group of other clinicians who are already working in the space. So through BSLM, clinicians can access all of the fantastic work that's going out there around type 2 diabetes, around nutrition, obesity, really for every specialism. And there are the 6 pillars, which we've briefly discussed earlier. But within that, around menopause, around gut health, around pain, there are lifestyle medicine specialists operating in that sphere. So one of the key roles of BSLM is to introduce our new diplomates who are newly qualified to all of these groups and individuals, so that they can adopt best practice, new practices, group consultation, whatever it might be, into their own practices. So that is in fact a key role of BSLM, is it's to support new diplomates to be able to practice lifestyle medicine. And one of the things that we're keen to do over the next few months is really to increase our level of support that we give to clinicians who are seeking careers in lifestyle medicine. Because at the moment, as you know, in a sense, you can't have a career in lifestyle medicine because there is no lifestyle medicine discipline, but you can certainly adopt lifestyle medicine approaches into everything you do, and that's what we are doing to support. We're aiming to support clinicians far more in that area moving forwards.
And you did mention Dr. Rob Lawson, the chairman, who has started BSLM with other co-founders. Would love to find out who is who in BSLM, and are there other key players who has pushed this forward, and what was their vision?
Yes, so as with all charities, there's a board of trustees. Dr. Lawson is the chair of the trustees, and Dr. Lawrence Stewart and Michael Boyle still sit on that chair with 8 others. So there's a total of 11 trustees who are overseeing the governance of BSLM. So they took a decision in sometime in early 2020 to really take the organization from a volunteer-led organization, and actually unbelievable things had been achieved by the group of volunteers that set up BSLM. I mean, we really should not underestimate the work of Rob and his colleagues in achieving what they did. But the decision was taken to almost take the next step with BSLM as a charity. So this decision was taken to appoint a full-time executive director, which was me, thankfully, and I'm delighted to be here. And then it was my role to create the office function, and then to start to think about everything that we need to do to make BSLM that professional organization that will enable all of the work that we're planning to do around lifestyle medicine and achieve everything that we hope to achieve, because we do have extremely lofty plans for the charity, and we can touch on that a little bit later perhaps. But without the governance structures around a formal office, HQ for want of a better word, it's really difficult to move a charity on. So establishing the office function allows us to establish the longer term credibility moving forward, because what Rob and his team have achieved is an incredible amount of credibility based on lifestyle medicine and the practice of lifestyle medicine. The next step really is to create the credibility around the governance and around the systems within the charity, so that people outside see a really competent, confident, ambitious organization moving forward. So that's kind of what we're in right now, and will be the next step of the organization's journey for well, probably another 18 months or so. It takes a long time to establish all the right systems to expand a charity.
You have mentioned how it kind of started, but I would love to dig a little bit further before we move on to where next. You mentioned that Rob Lawson was one of the starting founders. Could we have a little bit of a timeline on how and where and when did BSLM get the inspiration to be formed as a foundation, and how many years has it been in function now?
Well, I think Rob, and don't quote me on the exact timeline, but Rob would probably argue that he's been practicing lifestyle medicine for 25 years. So the idea has been around for a long time. And Rob started up a charity in East Lothian, which was for the benefit of people with cardiovascular problems, post-surgery and people with significant illnesses, to actually take them beyond just the visit to the GP or the specialist in hospital and the medication, the pharmaceutical interventions that are often very essential, but to take people into much more the physical exercise, the dietary advice, and the peer group support that people really need, because obviously don't need to explain to you as professionals, that post-surgery or people with significant illnesses also suffer from stress, anxiety, depression, and so on. So this was about actually alternative methods rather than just prescribing drugs. So Rob's been doing this for 20 years, but decided in 2016 to establish the charity. So it was incorporated in 2016. So we're celebrating our 5th anniversary this year. The first conference was in 2017 with 100 attendees, and then there's been an annual conference thereafter every year, and the membership has grown steadily. So membership in 2017 was 197. In 18 it was 643. In 19 there were 1,000. So it's grown steadily. So really our next goal is to consolidate where we are now, because it has been tricky in the middle of a COVID pandemic. Membership has slowed a little bit, but if ever there was a time for lifestyle medicine, it's right bang in the middle of a COVID epidemic, or I should say now towards the end of a COVID epidemic, hopefully. So really, we want to really push on that membership and expand. I would love to say exponentially, but that's slightly too optimistic, I would suggest, but significantly over the next few years. So as I said, the charity is 5 years old now, and we now have the structure in place, or we are developing the structure to go on to the next step, which is to implement those larger projects and to implement those kind of loftier ambitions that we have as a charity. I mean, Rob is probably too modest to tell you, but has huge ambitions for the charity, and he always has. So really, it's up for us as the executive team, and at the moment that's Emma Mulligan, who I'm sure you've come across, and Andrew Howie, who heads up finance and business development. To take that vision onwards and actually put all of the building blocks in place to make that possible.
And more than ever, we need that exponential growth, and we hope for BSLM to be that, because 89% of the deaths we know are related to lifestyle diseases. So it's either now or never that we get into gear and really help both of our patients and our colleagues to get on the right path. And Bslm is doing an amazing job to promote the root cause disease reversal. Couldn't stress it more, because that is what Bslm stands for in my mind as a physician, as a community of healthcare professionals who are led by similarly passionate, non-clinical leaders like yourself, who reverse their own diabetes, and I must applaud you on that, to a world where we can have patients who get better with medical treatment rather than just get their symptoms treated and just get worse every single year. So I really hope for that exponential growth. So from a practical point, we have grown quite fast as lifestyle physicians, I guess, because we feel the urgency and the need to address these root causes. But also we have found a community where everybody has a similar positive mindset, empowering message that is super inspiring, and would love to find out, where is BSLM going next? What are the ambitious goals that you and the team has in mind for all of us?
I think there's two sides to that answer. So there are internal matters that we are working on that I'll briefly touch on, and then there are the big sort of the external projects that we're looking to develop. So in terms of the internal side of things, we're still in the process of implementing all of the systems that are required by a maturing charity to be able to deliver on all the projects that I'll talk about in a second. So all of the systems around how we deal with the members, really basic stuff, but really important stuff, because if we don't have that right, we can't reach out, we can't email everybody because we don't know who our members are, and we don't have up-to-date email addresses. So these are all fundamental tasks that we're going to be concentrating on, and are concentrating on probably for the next, certainly for a further 6 months, to ensure that all of the systems are there in place to get us ready for the next step. And that includes not just the membership, but the special interest groups that we have in BSLM. So we have special interest groups around pain and around sleep and nutrition and so on, where individuals come together, like-minded individuals who share a passion in a particular area of medicine, and actually help BSLM to define the message, and then to be able to get that message across to not only clinicians, but across to patients as well. But also we need to establish the right culture in BSLM, and that's that is incredibly important for a charity. And I come from, I'll be frank here, I have worked in organizations where bullying has been a major issue, and a passion of mine is to work in organizations with a no blame culture, and certainly a zero tolerance to bullying. So really from the bottom up, we want to create an organization where everybody is welcome, where all viewpoints are welcome. And I think that's incredibly important for the membership as well, because if we start to go down particular lines around whatever way you want to describe it, dogma or whatever way you want to describe it, then actually we just alienate people. And I think that's one of the key tasks that we want to, really nail down is the way that BSLM gets a message across, and it's how we deliver that message. As I said earlier, BSLM is not about blaming people. It's not about the blame culture at all, and I'm talking about patients here. So we really need to ensure that the message that we get out is always inclusive, and is always supported by evidence, and that's a key part of British Society's Lifestyle Medicine's aims and objectives, is to make sure that we're firmly and always embedded in evidence. But once we've got all these systems in place, and really Emma Mulligan is leading on the systems development, she's doing an absolutely fabulous job, then there are those kind of bigger headline projects that we want to tackle. And I think the starting point of that is actually to take control of the narrative as a charity. So previously, what we've done a lot of is enabled those networks and enabled that networking between all of the clinicians. But when things have come into BSLM, so somebody has approached BSLM and said, I'm really interested in pain, what we've typically done in the past is, fantastic, talk to this individual, and then that's kind of been it, simply because we haven't had the structure to kind of formalize those relationships much more closely. So what we're now doing, and by controlling the narrative, I don't mean that in any dictatorial sense whatsoever, but what I mean is that BSLM is now becoming involved in facilitating work and facilitating projects, and hopefully facilitating research moving forward, by actually bringing people together and managing that interaction with a small m. I mean, it's very much up to individuals how they work within special interest groups and how they work in their own lifestyle medicine practices. But BSLM being able to offer much more proactive support around that, around the fundraising, around perhaps career advice, and so on and so on. So in controlling the narrative, what then it allows us to do is really focus in on projects, what we want to do as an organization. And really the kind of 3 or 4 big projects that we're looking at the moment is the Learning Academy, which I spoke about previously. So we've just purchased a learning management system, and I don't think I'm breaking any confidences in saying to everybody, it was very expensive. It was £40,000, and the implementation of that will probably be another £40,000, so very expensive. But what that does is that actually achieves several goals for BSLM. It really sits BSLM firmly in that education space, and through producing a really high class system with really world-class content, it then positions BSLM as the primary organization for the delivery of education of lifestyle medicine, which is absolutely what we want to do. But really important for us is we've gone for a very expensive learning management system for a really good reason, and that is because it is operational at many levels, and one of the things that we want to do moving forward is engage much more with the public. So really the second big project that I wanted to touch on today is our public facing image as BSLM. So I think it's probably fair to say, and I should be careful in this, but I'll say it anyway. BSLM, or rather lifestyle medicine, not BSLM, lifestyle medicine can often be seen as a very middle class thing. And I think that's something that we at BSLM need to tackle. We really need to think about social, financial, economic, environmental exclusion, health exclusion, and so on, health isolation, sorry, and so on. And one of the ways that we can do that is by developing our public facing offering. So the learning management system sits really right at the center of that. So ultimately what we want to develop, and this is a long-term plan because these things take a long time to develop, what we want is a system that the public can actually use as well. So really easy access online, but really easy access offline as well. So everything that we want to produce can be mailed out, can be sent out. It's not for the digitally skilled only. It should be for everybody. And we want to make sure that we're reaching those groups and individuals that typically are not engaging. So, different ethnic groups. We know that BAME cultures don't always engage very well with National Health Service, and certainly from my background coming from dementia previously, You know, the BAME community did not want to engage with dementia charities in any way, but also, you know, people living, you know, postcode lotteries, as we've kind of come to know them. So people living in areas where health coverage is not great, people on low incomes, you know, single parents with children, you know, worried about how to feed their children, who might not necessarily want to be thinking about lifestyle medicine as a concept. So the Learning Academy really is something, it's almost a catch-all for BSLM in that it's not just about clinicians and health professionals, it's going to be about everybody. So that's going to be a big focus for us moving forward. But as I said, that, you know, that takes time. And actually, to be frank, that takes a very large amount of money as well. So how do we achieve that then? So where does this large amount of money come from? Well, it can't solely come from membership and from our sales administration of the International Board of Lifestyle Medicine diploma. So we have to raise additional funds for BSLM, and I guess this is where I come in, and Andrew Howie as head of business of finance and business development. We need to be looking for those collaborations which not only promote lifestyle medicine, and that will always be the primary goal of BSLM, is to promote lifestyle medicine. I should be very, very clear about that. But equally, we also need to promote those collaborations that actually bring something back to BSLM in terms of a financial reward. So that might be, you know, engaging with, you know, it might be conference sponsorship. So we're engaging with corporates to sponsor the conference, so we can have an annual conference every year, which thankfully is going quite well this year, although is certainly being impacted by COVID as well. But also collaborating with organizations already working in the lifestyle medicine space. So we're talking to a number of organizations about you know, significant pieces of work that we might be able to do moving forwards around obesity, around type 2 diabetes, around the menopause, whatever it might be. Also talking to, you know, Group Consultations Limited, who we work very closely with around, you know, promoting group consultations as a key tool, a key driver for lifestyle medicine and behavioral change. But also then talking to individuals. So reaching out to, you know, those really very, very wealthy people in the world, the Bill Gateses of this world, the Richard Bransons, talking to them about lifestyle medicine, you know, showing them how important, how crucial this work is moving forwards, and hoping that people like that, people, you know, people with vast amounts of money, hopefully not to spend putting people into space, but spend on putting people, helping people address their health issues. And then talking, you know, the grants and trusts, you know, the big grant giving organizations, both inside the health system and outside the health system, you know, to generate that income that all charities need moving forwards to be able to develop their services. What I would say is, which is a really important point actually, and it reverts back to culture, and it's something I'm passionate about, certainly. There are a number of very large charities, and actually BSLM does aspire to become a large charity, but there are a number out there that have very questionable fundraising and business practices. And I'm not going to name them just in case, but, you know, some of the very large charities with turnovers of several £100 million, with fundraising operations that in themselves cost 30, 40, 50 million pounds. That's not where we want to go. We need to remain grounded, absolutely grounded, with patients first, the public first, clinicians being able to deliver, us supporting, and never ever losing that kind of, and you know, I'm not going to say moral or ethical, but never losing the focus that we started as a charity, and I want a small charity, and I really want the feel of a small charity to remain. So it's always a friendly charity, reaching out to people, always having the time to talk to people who come to us for help. And you don't always get that with large charities. So we really need to temper our ambitions with this cultural side of things that I'm really passionate about. So kind of that gives you a flavor. If there are any specific questions, I'm more than, you know, but those are the kind of the big news headline projects that we see moving forwards over the next 18 months, 2 years, 3 years, and so on.
Wow, that's a lot going on for BSLM. And you raised quite a few interesting points that I'd like to ask you about. I think that the thing that I would like to know the most is actually, you talked about health inequality earlier, and reaching these groups of people who may not necessarily be engaging with this sort of advice, practically, what are the practical ways of reaching these people? You mentioned about resources, but how do we get them to actually access them? Because
so there are several routes in there, and there are several business models around that which we're still kind of looking at and thinking about. And the first thing, I guess, is to ensure that everything we have at BSLM is accessible. So that's why I mentioned the learning management system should be available to the public, and we'll make sure that we can do that. It has to be accessible. But then the route into encouragement has to come from individual clinicians, individual communities, and that's where the membership becomes really very, very important for BSLM. Again, it's reaching out to the BAME communities, or to really areas that are suffering from significant deprivation, and working with the GPs, working with the local hospitals, working with other local charities, because we're very keen to align with local charities, be it homelessness or drug and alcohol addiction, whatever it might be, to actually help support them and provide them with information that they might need around lifestyle medicine. So actually, there's no simple answers to that, Erica. There are multiple routes in. I think if we get our fundamentals and our informational structure correct, then our membership can be encouraged with BSLM. I was going to say by BSLM, it's not at all, it's with BSLM, because the encouragement comes from the membership very often, to engage with communities and to provide the support in whatever means that might be. And that might actually also include BSLM applying for funding and helping members, clinicians apply for funding for projects in their own areas, and then BSLM providing all the courses, programs, materials, literature that actually enables the clinician and the professionals. Actually, and I keep talking about clinicians, and I should be careful here, because they're also the social prescribers and link workers that work in GP surgeries, who are absolutely crucial to delivering lifestyle medicine messages. Because, of course, people like yourself, Erica, will talk to patients, diagnose, but you'll signpost on to other projects and to group consultations and to programs that are available out there. So really, it's incumbent upon BSLM to make sure that people like yourself have access to all of those programs. Now, that's a lofty goal. That is an enormous project, but we really, I personally think we really need to think in those terms. We need to be thinking that actually, it is our role to reach out into all of these communities ultimately.
Yeah, I mean, projects big or small, it takes starting. Everything has a starting point, right? However small or big it is. So that's great. And I asked that because at afternoon tea with docs here, we're both really passionate about health inequality and reaching the people who may not necessarily have. You mentioned earlier about people might see lifestyle medicine as quite a middle class kind of way of practicing, and people may not have funds to pay privately to see practitioners who might be doing lifestyle medicine privately, and so we want to be able to provide this information to our general public, and hence I asked earlier about that. And talking about reaching these communities, what about kind of, are there any plans for, say, patient representatives from these specific communities, or maybe different resources in different languages, as sometimes language could be a barrier as well?
Oh, absolutely. I mean, I think that's a crucial part of it, because again, if things aren't patient-led in a sense, of course, the clinician will diagnose, the clinician will advise a whole series of potential interventions, some pharmaceutical, obviously, where necessary, others not pharmaceutical, others much more lifestyle medicine. But if that's not really driven by patients in a sense, that then they're not going to really succeed, and especially where we're working in difficult communities. So you're absolutely right. We have to make sure that the tools are there for everybody, be it, you know, translated materials, be it group consultations, so that actually people can sit, you know. So the best thing in the world for me to talk about my story would be actually to sit across a table with half a dozen other people with type 2 diabetes, perhaps not as far on with their journeys, and to talk to them about what I did. You know, I'm not for a minute going to suggest to them that it's easy, but actually by talking and by encouraging and by helping and advising with a very small a, because we need to be, you know, as non-clinicians, we need to be very careful what we advise. But if it's not patient driven, then it's actually not going to be as successful as it might be. And this is also where this message becomes so important, because when I was talking to my GP previously, I guess I'm the sort of person that really doesn't want to be told necessarily what to do. I really want to find my own way. Now, that's not for everybody, but I think this is the beauty of peer groups, where you can discuss together as a group what might be the best way forward for you. And by talking to people who have real world examples of how things can change, making very, you know, hashtag one change, you know, start with one change, start with very small things. I mean, I started by walking. My first step back into exercise was just walking. And to be perfectly honest, after a couple of 100 yards, I was extremely tired. But you know, it came, you kept plugging away. So I kind of digressed slightly there, apologies. Yes, we have to ensure that the tools are there for communities and for individuals within communities to actually run with things themselves, just as much as it's important to be supporting the clinicians to be able to signpost to all of these activities.
Okay. Earlier you mentioned about the special interest group as well. Could you kind of elaborate on the different special interest group that BSLM currently have?
Yeah, so there are special interest groups in all of the pillars of lifestyle medicine, you know, so, to be honest, some are more active than others. You know, again, this is still part of the process of developing the networks and developing the systems in place so that we can support special interest groups. But we have interest groups in nutrition, in sleep, in pain. We're developing an interest group in menopause, and it's an opportunity for people interested in a very specific area of lifestyle medicine to come together and discuss. You know, I have to say, with certainly UK-wide experts and very often world experts in the area. I mean, that's one of the beauties of BSLM, is that we have people, you know, as members who the rest of the membership can access, that are really world leading in their particular area. And it's absolutely, you know, it's fantastic to see that. And, you know, you asked a question earlier about, you know, how people can practice lifestyle medicine. Well, it's through talking to these people and getting advice from these people that will really help them establish themselves as lifestyle medicine practitioners. So the idea is that the special interest groups really help BSLM define policy and define positions. So you'll have seen recently the government released their paper, their food strategy around, you know, potential taxation and around salt and sugar and so on. So BSLM will have a policy statement that will have a position on that, and our nutrition interface group and special interest group is currently looking at that, so that we can ensure that it's not about telling the membership what they should be saying out there when asked about nutrition, food, potentially even taxation, but it's about ensuring that everybody understands what BSLM as the mouthpiece of lifestyle medicine is saying, so that you can then, you know, you can choose to accept that and adopt that, or actually you can come back to us and say, well, I'm not sure about this, and the special interest groups would be the focus for that discussion. But you know, a lot of people feel very strongly about this. I mean, I feel very strong as an economist. I feel very strongly about the taxation of salt and sugar. On the face of it, it's a very, very good thing. Of course, we should tax salt and sugar, and it will force manufacturers to reduce salt and sugar in their production. But taxation is a very blunt instrument, and taxation always affects the poor more than the wealthy, always. So we've got to be really careful with what we recommend. Whilst the recommendation in itself looks fantastic, great, let's go ahead with that, we need to understand what impact that's going to have if we're going to talk about the health and economic inequalities that might actually hinder the adoption of lifestyle medicine in some areas, some communities and geographical locations throughout the UK. So it's about having that position statement so that we can advise our membership, this is what the BSLM's point of view is, but absolutely willing to engage with you if actually you think BSLM is a bit off the mark here. And I've already made my views clear within BSLM about the taxation, and that will or will not form part of a strategy. So yeah, those groups are very, very important to us at BSLM, and hopefully there'll be more groups developing over the next few months and years, and they'll become really robust communities. And really the way forward for BSLM in terms of that policy definition, and then, you know, public engagement thereafter with government, with the health professions, and with the general public.
Yeah, you mentioned earlier that BSLM allows access to these different experts, and that's amazing. And you know, both Linda and I are members of BSLM and regional directors of BSLM, and we do interview experts on afternoon tea, and a lot, you know, of our guests are members of BSLM too, and through this we've been able to, you know, connect with each other and learn from each other, which is a great opportunity for everyone. And our public and patients can hear their point of view and their expertise as well.
Yeah, I would actually just like to say, I mean, afternoon tea with the docs is probably the best example of kind of on the ground work around lifestyle medicine to get the message out there and to explain what lifestyle medicine is and to engage with clinicians, but also patients. I mean, it's fantastic to be able to bring patients into the discussion, because very often, you know, certainly at a policy level, you know, many charities, and whether or not we've been guilty of that in the past, I don't know, don't necessarily engage charities, although actually I do know, because Rob Lawson has always been absolutely adamant that we should engage with patients, but it's not always the case, and that's exactly what afternoon tea with the docs does. So it's a fantastic example of spreading the word of lifestyle medicine.
Thank you, Fraser. And I mean, getting patient involvement is so super important, just like you shared your story about type 2 diabetes. And these are the kind of stories that inspire people to make changes. Knowledge is not everything, and people can know, you know, people know not to eat junk food, they know to exercise, they know not to smoke, but that doesn't necessarily translate into habits and lifestyle, because they're not surrounded by people who have the same sort of attitude towards things, and that can make things difficult. And perhaps they've not been inspired by their doctors or healthcare professionals to make those changes. Like you said earlier with your doctor, they did encourage you to lose weight, but that was kind of it, and you had to navigate it yourself. Whereas if we're hoping that when we share stories of patients on afternoon tea, that when people listen to those stories, that they're also inspired to know that they can also make those changes themselves to manage their health, and that they can be empowered to do that. Because if you see your peer being able to do it, you're more likely to feel empowered than if you're just told by your doctor to lose weight or exercise more, which we know doesn't work.
No, I think that's right. I was just going to say, I think that's right. And to take that one step further, I think where that message becomes potentially even more important is in schools. So we have a special interest group that's looking at education in schools. And I think it's essential that we as an organization try to get lifestyle medicine into the curriculum in whatever form it might be, to support kids who potentially, and again, I say this hopefully with sensitivity, but support kids who potentially don't have the role models to be able to make the right choices moving forwards. So that's going to be a really key part of our work moving forwards, I think, certainly in the coming years.
Oh, that's so important and so good to hear, because we need to bring that to the young communities who actually have a chance to turn their lives around. And as you said, it's very difficult and heartbreaking to see when they don't have those role models. And as physicians and a caring community, we really feel heartfelt about this, and to be able to be part of maybe the change that needs to be brought to the kids, especially here where I am in Sheffield and the outskirts in the north. The health inequality is really palpable, and it just breaks our heart to see youngsters not being able to look up to someone who gives them that role model opportunity, isn't it? It's really nice to see that BSLM is looking into that. And you mentioned that there is actually a special interest group as well. So
Yeah. Oh, no, absolutely. Looking at education in schools, and I think that's something. And again, the learning management system that we're implementing can support that, because we can, materials can go on that at any level, and there's no reason why that can't be accessed by schools as well moving forward. But Rob Lawson, he quotes a statistic when he's talking about lifestyle medicine, which is really quite horrific, actually, and it really focuses the mind, and that is that the children being born today have a life expectancy less than their parents, which actually is horrific, really, and that's something that we should all bear in mind. Certainly, we as the executive team in BSLM, when we're defining actually where our efforts should be focused moving forward.
Yeah. Absolutely. I wanted to ask you a few more questions about the Learning Academies. We've had a few questions coming in about it. You mentioned earlier that it's accessible to healthcare professionals, but also to patients as well. Is that right? Would that be the same resources for patients, or there would be a separate?
Different resources. So it's not accessible to patients at the moment, because we're in development. So the learning management system will probably develop over the next 2 years, but we're looking for a soft launch in September at the conference, and then we'll be gradually adding to. So what we think we want to achieve is kind of the high level education for those that really are asking for it, so the clinicians, the professionals, and so on, but then exactly the same materials available for the public, but in a different format, so in manageable and understandable chunks. So when we talk about gut health, that's more understandable than when we talk about perhaps the microbiome. So we're having microbiome modules, but we probably won't we certainly won't use the same terminology for clinicians that we would in just kind of a guide for the public around gut health. So it's things like that, pain management, certainly we were looking at the technicalities of pain management, but for the public, much more practical advice on what you might want to do. Exercise is fundamental to pain, and movement is fundamental to pain management. It's not something GPs always tell us, and my wife's given me permission to actually use this example. She suffers from really quite bad arthritis and has periodically suffered from really bad pain, and her GP told her not to run, and her physiotherapist said he hates people that run because running causes damage, and it doesn't. When she started running, the pain went. She still has it a little bit, but it's nowhere near, and she's come off pain medication that she'd actually been on for several years. So we can talk about that in the kind of physiological sense to experts, but in terms of public consumption of those facts, it's just the practical stuff. It's the whys, why should we do this, and what does it mean? What does it mean for the body? What might happen? So on and so on. So yes, everything will be accessible ultimately to the public, but as I said, there's a kind of a timeline on this, and that's probably kind of the latter stages of the development, because we need the basic content first, which is happening now and will continue for at least 12 months probably.
Okay. And what time frame are we looking at with regards to BSLM forming the Educational Academy to replace the International Board of Lifestyle Medicine exam diploma?
That's a tricky political question, Erica.
That was one of the questions.
But it's a good question, and it is the aspiration of the British Society of Lifestyle Medicine to have its own diploma. So what the International Board diploma allows you to do is practice lifestyle medicine across the world, which is great. So the British Society of Lifestyle Medicine diploma wouldn't allow you to do that. It would only allow you to practice lifestyle medicine in the UK. So people would still have a choice whether to go international or whether to go UK through BSLM. And I would certainly hope that they would go with us, because ours will be a bespoke diploma for the UK market, for the UK health system, UK health professionals. So I would hope that that's no more than 12 months away. Now, please don't absolutely hang me to that time scale, but that's what our aspiration is.
Great, that's good to know. Thank you, Fraser. And could I ask you now to maybe talk to us about the conference? You just mentioned it, and the soft launch of the Academy in September. So tell us about the conference.
Yeah, thrilled to talk about the conference, actually. So 18 months ago, Rob and Lawrence, trustees of BSLM, signed the contract with the Edinburgh International Conference Centre to hold a physical conference. Now, if ever there was a leap of faith, that was it. But I think it was absolutely the right decision to make, because I think we all aspire to get back face-to-face with people in the safest possible sense. So we have been planning for our conference for 12 months now. Huge amounts of office time going into it, obviously, because we want a world-class conference with world-class speakers. And Rob and I, along with the conference facility, the Edinburgh International Centre, we met with the Scottish Government on Friday to propose the conference as a gateway project. And what gateway projects are kind of pilot projects that will examine the possibility of getting mass participation events back up and running. And we presented our case, and the EICC talked about all the measures they'd taken around ventilation and one-way systems and so on. And the Scottish Government had no operational objections and no clinical objections. So whilst we were always going to go ahead with the project, we now have government backing for an official face-to-face conference in Edinburgh, which we're absolutely thrilled about. And I think that's really important. It's a really important milestone for us, because we know for a fact that there are a number of people who have not booked because they don't know whether we're going to go ahead or not. They're worried that actually it'll be cancelled at the last minute. Well, finally, we can say that the project, I was always certain anyway, but we can now say officially that the conference will go ahead, and it will be face-to-face. So at the moment, we've got about 400 in-person delegates, and I think without COVID, our aspiration would have been 1,200, but I absolutely understand where we are at the moment. So at the moment, we've got about 400 in-person delegates. I think that's probably going to cap at around about 550, because we know there's a lot of people waiting for this message. And then we'll probably have about 250 virtual delegates as well, because the conference will be hybrid. So it'll be live, the whole thing will be live streamed and interactive as well. So people who are accessing the conference remotely will be able to engage with all the sponsors, the speakers, just as they would as if you're there. Not quite the same experience, obviously, because we're all absolutely thrilled to be able to get together. We clearly will still be being cautious, so we'll still operate hand sanitizers, we'll take temperature checks on the door, we'll advise people not to travel if they're not feeling well. People can wear masks if they want, although as part of the Gateway Project system, they're absolutely not obliged to. We'll ask people to social distance where possible, but again, they're not obliged to, because the whole point of this is to test the ability to run large-scale projects again. So we're going to be very cautious, and we'll advise caution. But the wonderful thing is that our delegates, our customer base, if you like, all come from the health system and absolutely understand about infection control and about caution and about not bringing COVID in and not taking COVID away back to their workplaces. So actually, I think that's probably what swung it for us with the Scottish Government, just the fact that we had a very knowledgeable and diligent delegate base. So we're absolutely thrilled. We've got some fantastic speakers. We've got I was about to say, there's a standing joke in BSLM. I was about to say Phil Spector, but no, Tim Spector's coming, and that's absolutely fantastic. Professor Roy Taylor to talk about type 2 diabetes, Dame Sally Davis, Professor Linda Bold from Edinburgh University, who's chair of public health and has been the Scottish face of the kind of the common sense message around COVID for the whole pandemic. So we're absolutely thrilled that she's coming. So it's a tremendous program. fabulous opportunity for our diplomates to come along and meet other lifestyle medicine practitioners and other diplomates. And there'll be a Learning Academy session as well on the Saturday, where we're going to talk about, what's coming in the Learning Academy, in the learning management system, what courses we're developing and so on. So again, there are fantastic courses going on there. There's a microbiome course, type 2 diabetes, obesity, fantastic courses being developed that'll go on there, and we'll talk about those at the conference. So we are just absolutely thrilled that we're actually going to be able to meet people face to face at the conference.
That's so exciting. And we're both signed up to go in person.
Brilliant.
So hopefully we'll see you there, Fraser, for the first time.
You will.
And is this open to just clinicians, or is this open to the public as well?
No, it's open to the public as well. So anybody that would like to attend can attend. And what we're actually about to do, which is interesting, so kind of watch this space, is to reach out to our regional directors and ask regional directors to nominate a patient who they think would benefit from the conference, but also, has a story to tell as well. And they won't have the opportunity to tell that story at conference, but clearly they have an opportunity to engage through social media with what's going on in the conference. So we're going to provide free spaces for patients as well. So you as regional directors will be getting an email reasonably soon. And I know it's only one. I would love it to be thousands. It may be slightly more, but we'll see. But yeah, we would love patients to be able to actually see what's going on in the world of lifestyle medicine, hear the really world-renowned clinicians, but also then talk to people, see people who are very early on in their lifestyle medicine journey, and also see some slightly left field things. So one of the presentations this year looks really great. It's about the kind of the mental health benefits of public art and public spaces. Now that's really interesting. So it's not just the hard science. There's some really good, interesting, I guess I would say, practical presentations as well.
Amazing. And the conference, the link to book the conference is in the chat if anyone is interested, if you haven't got your ticket already. And Linda, do you have anything else to ask?
I think what's very inspiring here is that we are on a journey together, and it's the beginning of something huge to come. And what's exciting about it for us is that we can be part of shaping and changing the future of medicine. And I think Bslm really offers that platform for all the physicians who are inspired to make that change. And that's more than what we could ask for as physicians, because having that purpose is really pushing us forward to wanting to make a difference that is beyond us. So thank you for that opportunity. And anybody who is in the healthcare professional space, I believe you guys let also nurses, doctors, and in the future coaches as well to train in lifestyle medicine. Is that correct?
Yeah, that's absolutely right. And I think that's one of the things, again, that we want to focus on moving forward. And of course, we won't ignore our clinicians. We absolutely won't. But we've got to open it up. We've got to broaden the kind of the family and bring in, physiotherapy, dentistry. We actually have members that are dentists in Bslm, which is great. But you're absolutely right. Coaches, people who are not necessarily practicing medicine, but are very much key to the practice of medicine in the National Health Service, and nurses are absolutely key to that. So we really want to expand our nursing membership. But to do that, we have to have the right offering. So these are all things that we're working on at the moment. Why would a nurse want to join us? They might see us as just a clinician focused organization, and we're not, but we need to get the message across that we're not, and in the right way, and then have real benefits for nurses as well. And one of those is the ability to do a diploma, which is slightly different to the clinician's diploma. So these are all things that we're working on at the moment. But you're right, we're open to all and welcome all.
And actually, on that point, could I also ask, because I understand that I know of some healthcare professionals, like healthcare assistants, who may not necessarily have a degree, but would also like to do the diploma. Is there any way in the future for them to access this?
Yeah, that's an excellent question, Erica, and thank you for reminding me, because I should have said this really. So one of the things that we really want to promote is kind of a route into lifestyle medicine. And you're absolutely right. There are hundreds of thousands of people working in the health space that don't have that, not only a medical degree, but any degree, and that prohibits them from entering formal education in a lot of different ways. So one of the things we want at BSLM is to really be inclusive. So there'll almost be a kind of a foundation course, an access course that will be aimed specifically at people who don't have the academic attainment but have the practical skills, the knowledge, and then there might be anything from allied professionals in the health service to link workers, social prescribers in the GP surgeries, and so on. So we've got to find the right way to encourage all of these people to become members, because they've got, not only do they have so much to offer, but actually in a very real sense of the word, they are very often the people that are the lifestyle medicine interface with patients. They are talking to patients all the time, involved in the programs, signposting to other programs. So yeah, it's a very good question. I'm glad you asked it, because it is so important to us.
Absolutely. I mean, they are so key in chronic disease management, and they're a key part of the team. And for them to be able to access the knowledge that BSLM is able to offer, the resources, would be really useful, because as you said, they've got the practical skills, even if they don't have that medical degree to back them up. They are the ones who are doing the work on the ground, and are so important. And often patients relate to nurses, healthcare assistants, link workers better than they do with their doctors.
Yeah.
So yeah, thank you for that, Fraser.
Yeah, and just to add to that, we really strongly feel about this, because we believe the community is what makes a difference, and there are only so many doctors out there, but to train even the public in these skills will allow the community to grow from within out, instead of having this patriarchal one-on-one medicine that we have practiced for too long. We have to re-empower our patients once again, and within them, the community members like social prescribers, nurses on the ground, coaches, nutritionists, and dietitians, and everybody should know about this incredible knowledge, and that is put into such a practical steps. So good to hear that we are going to re-empower our communities and not just clinicians. That's super exciting going forward. And before we move on to our second half of our event, where we have a more cozy conversation with you and answer any direct questions, we would love to just remind anybody from BSLM or lifestyle medicine that the afternoon tea is here to serve you and the public. So do reach out to us if you would like to be hosted on the show for an afternoon tea, so that we can get this life-saving message out to the public. So we are here to serve you, and if you are a patient who have used lifestyle medicine or the principles of nutrition and lifestyle in your life to reverse your disease, then please come on and share your story with us to inspire so many others to take the steps. So we would love to ask you to close this session, this incredible session, with our usual by asking, what are the 3 actionable takeaways, do you think, Fraser, for implementing for clinicians and healthcare professionals in their practice from a lifestyle medicine point of view?
I think the first thing I think is really a simple one, and I guess in a sense that you would expect me to say this, but I think the first thing would be to please join the British Society of Lifestyle Medicine. That achieves 2 things. It supports the charity and allows us to go on doing our work, but then it gives you access as clinicians the opportunity to engage with all of the other membership, the special interest groups, the regional directors, and everything that's going on within BSLM. And the second thing I think I would ask is that actually you not only join, but you really engage with BSLM. There's a lot BSLM can offer the membership, but actually it's more that there's more that the membership can offer BSLM. So we are always looking to make collaborations with people wanting to practice lifestyle medicine, not only to support them to practice lifestyle medicine, but actually to learn from them as well. And I think the final thing would be for the clinicians would be to engage with the learning management system. So we want people to write courses for us. Now, we absolutely appreciate how busy people are, especially in these current times. But you have an opportunity to create courses for us and with us, have them online and have them sold online and promoted online through BSLM, which in turn can help you to support your own lifestyle medicine practices. So I would just ask you really to join BSLM and engage with us and to talk to us about how we can support you, but also as a charity, how you can support us as well.
And that does bring us on supporting financially, because in this world, unfortunately, everything costs quite a lot. And I know that you have started a bike ride to raise funds for BSLM, and I think you will continue that on another time. Is there anything that people can do like you have done to raise money to BSLM?
Well, I think that's a good question, and that's one we've actually been toying with, because we're an interesting charity. We're a membership charity. You know, we're not the only membership charity, but we're not a single cause charity. Now, if you have something like Alzheimer's Society or British Heart Foundation or the very many cancer research trusts, it's very easy to say, ride a bike, raise some money for Alzheimer's, for cancer, for heart and stroke, whatever it might be. It's more difficult for that for us to get that message across as BSLM, but we do really need people to engage with us on that level as well. We are a charity, and we would love people to be doing, you know, marathons and half marathons, not least because it promotes physical activity, which is what we stand for. But so we need, there's a bit of education, I guess, or that's probably the wrong way of putting it. There's a little bit of communications that we need to put out there around, you know, please don't forget we are a charity, and we are absolutely open to you running any type of activity, a coffee morning, a tea morning, a cake morning, a half marathon, a marathon, 100-yard walk, a 20 yards, whatever it might be. We're absolutely open to that. We need to refine how we ask people to do that, I think, to just let people know that we are absolutely interested.
Is there a donation link at all where people could actually practically add to their website or to their social media?
Yes, there's a donate button on the front page. It's probably not big enough. I'll need to make it bigger.
Great, it's good to clarify, and we will be able to promote it, because yeah, we do forget quite often, because you're doing such a good job and it seems like everything is running so smoothly that yes, you're a charity, and we need to make sure that we support you so that we can actually address the root cause of diseases and create a community going forward that is meaningful and that allows doctors once again to become healers. So we are really up for that. So thank you so much for those points. This was an incredibly inspiring discussion, I feel, and it put a lot of light on where we were as BSLM and where we are going in the future. We are looking forward to offering our platform to BSLM in the future. So if you're a regional director and would like to get a spot on afternoon tea to share your own stories, do get in touch with us. That will be something that we can offer, maybe also to raise some funds for BSLM through these discussions, just so that we can promote a healthier future. So we added the links for BSLM in the chat, and we'll add it on YouTube as well. You can check it out on bslm.org.uk. They are on Twitter as well as on Instagram. And tomorrow, as we discussed before, we have patient success stories. And tomorrow, I have our BSLM Regional Director, Dr. Susan Canali, who is going to share her story of how she has empowered herself with lifestyle choices after her cancer diagnosis. So it's another example where lifestyle medicine is used with such heartbreaking diagnosis as cancer, it can be very empowering, and that's what we are going to be hearing about tomorrow. So do join us here on Zoom, or you can check us out on YouTube, where this and the future events are always live streamed, so you don't miss out. And do stay connected with us. We will add the links just below, so that you can say hi on Instagram, YouTube, or on Facebook, and join our members area.
And please do comment in the chat or on YouTube, Facebook, wherever you're listening, and let us know what you thought of today's afternoon tea, and let us know how we're doing and what kind of things that you would like to hear about next. Thank you for listening, and have a lovely evening.
Thanks, guys. So off we go to Zoom.
Bye.
Bye-bye.